7 o'clock. Now, the Pasifika Medical Association Medical Assistance Team, known as PACMAT, has been given the green light to deploy to Tonga next week. And this is, of course, in response to the needs of the community following Tonga's volcanic eruption and tsunami. And now, of course, Omicron outbreak. Joining us now to have a talanoa about this is Pasifika Medical Association and also Pasifika Futures CEO, Debbie Sorensen. With that, I say, Malo Elaine, welcome to the show.
Malo tamau pongi ni Eggy. Lovely to talk to you this morning.
As always, thank you so much, Debbie, for giving us some time this morning. You know, last time we caught up with you, of course, the PACMAT team was actually ready, right, to deploy in regards to the Tonga crises. Obviously wasn't given a green light because of all the changes in regards to COVID-19, but now you have the green light. I suppose, is the team looking forward to sort of heading over now?
We've got an 8-person team that's heading away next Wednesday, and they are beyond excited. It is, of course, a totally Tongan team. And so one of the conversations we've had is when our country calls us, we need to go. So people are excited, they're anxious, wanting to do a really good job and make sure that everything's in place. I think that they are also thinking really hard about how they can work, you know, do the most work and provide the most assistance while they're there. So it's a very exciting time. We only had about 8 days to actually get people up and ready, and they'll be away for 5 weeks for 35 days. So it's a bit of a longer mission than normal.
Yeah, absolutely. And of course, I'm thinking about the preparation. You would have probably already been prepared before, but obviously things have changed because now the fact that Tonga is facing COVID-19 cases, yeah, what's sort of the makeup now of what you need to prepare for?
You're quite right, actually. So we have to take a specialist infection control nurse, and she'll be responsible for making sure that every day everyone is RATS tested before they leave their rooms, making sure that they have a PCR test every week, and then making sure that they are wearing PPE while they work and that those working protocols are really undertaken. And she does symptom checks for people every day as well, before they leave and when they come back from work. So that's been one of the changes, and the mission is to add that extra person as an extra level of safety.
Yeah.
Of course, we've had to make sure that we can get accommodation where we can actually live as a bubble, so that the team stays on its own. It's only the team, and they actually keep within that bubble and go to work and back. So really just trying to keep safe, both to make sure that the team itself is safe so that it can work the whole time, but also to make sure that they don't actually, you know, be a risk to anyone there.
I think, Debbie, you know, it's great to hear that the composition of the team is actually made up of all Tongans, you know, of course, heading over, because that obviously makes even the dialogue a whole lot easier. But I remember, you know, there were sort of concerns about the mental health of even the Tongan community. Is there anyone else like that who was within the team that is going over?
Yes. Well, the whole team is actually a psychosocial mission. And so we have our clinical team lead is Dr. Sione Vaka, that's known well to you, our most senior and experienced Tongan mental health nurse. And then we have a couple of other mental health nurses and a counsellor. So it's a psychosocial group. They will work alongside the Women and Children's Crisis Centre, with Ocha Gutenbill, and so work in the NGO area and work out in the community. And then, of course, if the mental health services need support in the hospital, they're always available for that. And so you're right, Aggie, the real advantage, and I think it's really something that we think we have a superpower in, being able to put together a team that are Tongan speaking, that have lived, and many of them were born in Tonga and gone to school there, so already have networks, already understand the way that we're able to do the work, but also the context of mental health support for the Tongan community. So we're very excited.
And I think even after the whole 5 weeks that they're going to be there, though, Debbie, what is it that I suppose you're actually wanting to see or accomplish by the end of that mission?
Yes, so they'll have two really big jobs. One is to provide support to families, to young people, to children who have been traumatized from the events, since January. And that includes the stress from Omicron in the community. The second thing is they'll be delivering a lot of training, so psychosocial mental health training in the community. And again, because they're a Tongan team, they can do that. Tongan language, translated resources into Tongan, be able to contextualize the way that work's done. So really practical things like helping people to, training people so that they can do short interventions with people in the community. So often people, when they're traumatized, will say, well, I haven't slept properly for 3 or 4 months. What should I do about that? And so you can actually talk to people about, no screen time before you go to bed, winding down slowly, making sure that you do exercise during the day, no coffee in the evenings, a whole lot of sleep health practical things that will help people to sleep, and talking to people about how you deal with your anxiety. So that sort of training is really a legacy that can be left behind. And then I think the third area is the ability to actually then provide our colleagues in Tonga with remote support from New Zealand. Nice. So being able to continue Zooms like this, where they can talk about, the challenges they face, but also more training. So you're quite right, 5 weeks going in, going out, a bit like missionaries, bless them, they do fantastic work, but we need a bit of a longer horizon. Making sure that there is a legacy left behind, and that very practical things that our colleagues, but also people in the community, can actually use.
Yeah, Debbie, will the team though sort of, I suppose, access or assess the extent of need while they're there? So obviously they're there for the 5 weeks, but if they seem like there's maybe a bit more help that's needed, do they get to extend their stay, or will another team be ready to deploy?
Yes, we have 2 of those options actually. So there would be an option if the Tonga government asks for an extension for the support. So there would be an option that team could stay longer, or that people could rotate out, and we have a what we call a Bravo team that are on standby. Nice. Who potentially could deploy for another 35 days. So it's a bit hard to know until they're on the ground, but certainly the option is there for extension and, additional work going on. Yes, you're quite right.
Awesome. If you're tuning in, we are catching up with PMA and also Pasifika Futures CEO Debbie Sorensen. It's great to hear, though, that we understand the Niue PACMET team was sent to Niue before. Now they've obviously recently returned. What were they able to do though while they were in Niue?
Oh, we're absolutely thrilled with the work they've done. They were in Niue for 4 weeks. And so they went up on request by the Niue government, and it's part of a direct partnership between PMA and the Niue Ministry of Health. And so we funded that mission ourselves totally, and we sent up a team of 5, and they couldn't have been a better fitted team for what Niue needed at the moment. Of course, little did we know that Niue, while the team were there, would get their first case at the border. And so that provided a real live example to be able to assess Niue's readiness, how they might set up their protocols to manage both people in quarantine, but also if there was community transition, to do training on contact tracing and putting in place all the protocols. So it was fantastic. We had a Niuean GP, Chloe Punsamani, with us, who was absolutely brilliant. And then a team of 4, 3 of whom are nurses who have spent the last 2 years working in the quarantine facilities and working on the border. So the team were able to come in, their experience in going through the airport process and the quarantine process, to then, have a discussion about how can we strengthen that, and then to work with Niue government around strengthening up their policies and their operating procedures and processes, and of also doing quite a lot of training. And they did translated resources as well, which was fantastic. So it's been an incredibly successful mission. The Niue government have been very pleased with the way that worked out. And as I say, the timing and the composition of the team couldn't have been better.
Yeah, I love hearing that. That's such great work you guys are doing, Debbie. As always, just key messages that you'd like to let our listeners know this morning.
I'd really like to say to people that we're almost there. It has felt like a very long 2.5 years. And I think, you know, we have missed lots of things and there have been lots of challenges for us over this time, but really to say to people, keep heart. We're almost there. The changes that have come in this week will make it easier for us to continue our lives, but also, you know, we understand we need to protect our families. So the key message is, you know, if someone in your family or someone in your household or yourself, if you have Omicron, stay home for 7 days. You know, it's as simple as that. Make sure everyone gets their booster if they aren't, and also to make sure that our children are immunized from 5 years up. So I think those are really the key messages, and just to take heart, we're almost there. You know, we will see a bright summer coming.
Thank you for that, Debbie. Look, as always, we really appreciate your time and coming on the show, but thank you for all the work that you are doing with the team. I know Tonga's looking forward to that, your PACMET team coming over there. So malo pito.
Malo pito, Eki. Thank you.
No worries.